Hello, everyone. Good afternoon. My name is Kenji Maeda. I am the Executive Director of the Greater Vancouver Professional Theatre Alliance. Before we get started, I'd like to go over a few of those key features, as we all know on Zoom, around how to engage. You can turn on your closed captions by clicking on the CC button, usually at the very bottom of your Zoom window, to follow along that way. If you have any questions for the panelists, I ask that you put them in the Q&A window because that helps to focus where the questions, where I'm going to be reading those questions. We did receive a bunch of pre-questions or pre-submitted questions as well, so I'm going to be starting off with those. If you have any technical issues or questions that come up, please put them in the chat and Amanda will provide you with some assistance. I do want to thank our ASL interpreters today, who are Sharon and Carmen, to help us with this session. I'd like to acknowledge that GVPTA is based on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations. As we think about the past decades, the past year, months, and recent weeks, acknowledging the land and the rights of Indigenous peoples is one part of our responsibility. We must ensure that we move into action and make decisions that respect the culture, ceremonies, and lives. As an individual, I take responsibility to navigate what I can do personally. And as someone who helps make decisions for GVPTA, I take responsibility to think deeply and mindfully about how we structure, plan, and operate our organization, our programs, and our services intended for the community. So today's session, which is a Performing Arts Town Hall on BC's Restart Plan, I'd like to mention who is here today. We have Hayley Miller, who is the Project Director from the Office of the Provincial Health Officer, BC Ministry of Health. We have Dr. Mark Lysyshyn, Deputy Chief Medical Health Officer for Vancouver Coastal Health. Don Parman, Manager of Performing Arts and Live Events, Actsafe Safety Association, and Lisa Houle, Manager of Occupational Health and Safety, Consultation and Education Services for Municipalities, Arts, Tourism, and Hospitality, WorkSafeBC. And for context, as we all know, on June 15th, we moved into step 2 of the BC's Restart Plan, which opened up the opportunity to host gatherings of up to 50 people. As early as July 1st, we will move into step 3, which indicates increased capacity at both indoor and outdoor organized gatherings with a COVID safety plan in place, as well as fairs and festivals can operate with the COVID safety plan as well. Other restrictions such as masks and distancing are also expected to be eased. And as I get into the first question and have everybody introduce themselves, this session will go until 1 p.m. So we have about 60 minutes to have this conversation. So if you can introduce yourself, share what you and your agency or organization is responsible for. Maybe I'll start off with Hayley.
Sure. Thank you, Kenji, and good afternoon, everyone. As Kenji said, my name is Hayley Miller. I'm a project director with the Office of the Provincial Health Officer. Many of you may have heard of this office and the role it plays in this pandemic. Part of my role has been working with the Ministry of Tourism, Arts and Culture and with Dawn and others from the performing arts sector to help interpret PHO orders and to provide some advice and guidance on how to resume safe operations under those orders. So I'm very happy to be here today and be part of the conversation.
Great, thank you. Lisa, why don't we jump to you?
Sure. Hello, everyone. Nice to see you again. I'm Lisa Houle, and I'm with Consultation Education Services, which is part of the Prevention Division at WorkSafeBC. WorkSafeBC, if you don't know, is the regulator, the Occupational Health and Safety regulator for the province of British Columbia. That means our jurisdiction is primarily, well, it is workers and work sites. My team has worked quite closely. We always have worked quite closely with Actsafe and the tourism hospitality sectors. And over the course of this year, we've been very involved with writing best practice protocols for industry and supporting employers as they develop their mandated workplace safety plan. So I'm happy to be here and we'll always continue to work with you folks as things move along and we resume some semblance of normalcy.
Great, thank you. Mark?
Hi there, I'm Mark Lysyshyn, Deputy Chief Medical Health Officer with Vancouver Coastal Health. So as a medical health officer responsible for managing cases and contacts of COVID-19 in the Vancouver Coastal Health region, clusters and outbreaks, and then enforcing public health orders. I'm also a member of the Provincial Public Health Committee that's advising the government on the restart plan. So hoping to share some information from that perspective as well.
Great, thank you. Don.
Don Parman, Actsafe. We're not the regulator. We're here to help guide the industry through information, guidance documents, sharing of information, working with groups like Haley, Dr. Mark, different organizations to help get these issues brought forward, questions answered, and we basically just been trying to interpret and get the information out to everybody as in a timely manner as possible. And just really quickly, while I've got the floor, I just really quickly wanted to thank all three for joining us today, because Mark, Lisa, and Haley have all been a huge part of all the work we've done, and thank you for joining us today. It was so great to see you all. So that's me.
Great, thank you, Don. So going right into maybe some of that context question. So Mark, maybe we can start with you. Can you talk a little bit about the rationale about the phased restart plan?
Yeah, absolutely. So, more than a year ago when we, first saw COVID came out, it was defined as a pandemic virus because it was a new virus. It can cause severe illness, and the entire population was susceptible. And so we were very worried that the virus would overwhelm our healthcare systems and we wouldn't be able to care for the people who got sick. And we have seen in various parts around the world that the health systems have been nearly overwhelmed. In BC, we managed not to overwhelm our healthcare system, but we came close. We had to do things like, cancel elective surgeries and things like that, and put broad orders across society, and we managed not to overwhelm our healthcare system. But the way we controlled the virus was mainly through these public health orders and things like that, because we didn't have an intervention that could make people immune from the virus. So now we do. We have the vaccine, and we've rolled out the vaccine in great quantities, and greater proportions of the population are becoming essentially protected through immunization. We're over 75% of all eligible people in BC right now have received one dose of COVID vaccine, which does provide good protection against severe illness and reduces the risk of transmission. And so, now when we look at the virus, we actually don't have a pandemic virus anymore in BC because most of the population is not susceptible at the same time. And so it means that there's very little risk that our healthcare system will become overwhelmed, because the virus doesn't spread well now in the population, because if I have COVID, I'm much more likely to run into somebody who's immunized than somebody who is not immunized. And then even if I do get COVID, if I've been immunized, I'm much less likely to require hospitalization because the vaccine has prevented severe illness. So as we move to this third step of the restart plan, we're getting to that point where we're 2 weeks after every eligible person in BC has had an opportunity to get their first dose. So that's sort of the best first dose coverage we're really going to get. There may be some stragglers that decide to be immunized later, but at this point, really, the population is protected. And so that's why this third step of the restart plan is really important. This is where we're going to see a lot of things change, because we're going to go from treating the virus like a special pandemic threat to more of an endemic virus that circulates regularly, similar to how we might treat influenza or the other, milder coronaviruses that we know about. So this is really the transition that we're going to be going through in step 3. And it's safe to do this now because we have a safe and effective vaccine that has been, deployed across the population.
Thank you. So as the reopening plans or the restart plan was announced, can one of you talk about how the community was consulted before it was announced and how it was planned? Because certainly some members of our community felt a little bit left out around, what came out in the plans.
So when the plan was announced, there was initially a thought that we would need to consult with every different sector to figure out what the plan would be, going into September or into July 1st. But it became clear as we worked on the restart plan that actually with the lifting of most public health orders and the requirements for masking indoors and the need to be physically distanced, we realized that most workplaces could return back to pretty normal functioning. And there wasn't going to be a need for specific COVID safety plans in most sectors. And so there wasn't, I guess, a need to do this broad consultation, but there was consultations that happened with a few high-risk sectors that will probably still be restricted to some degree as of July 1st. And these are the places that really bring in a lot of people, sort of stadiums, casinos, nightclubs, places like this. There still will be some restrictions on those types of venues. And so those sectors were specifically consulted.
So speaking about July 1st, does anybody have information about what the projected increase in capacity will be for, because many venues, there are venues that are 100 seats, but there are venues that are thousands for the performing arts that are not stadiums. So is there any sense of what you can share with us around that?
Well, of course, these decisions are, are going right up to the top levels of government. And so because of that, they are often decided, just at the last minute before they're announced. So unfortunately, I can't tell you what the limits will be. But I think if I can share some of the thinking around this, is that because, again, we have this virus that is now doesn't need to be treated like a pandemic virus, we're not going to require people to be physically distanced from each other. So when they're in public places, people, can now be close together again. They won't have to wear masks indoors. Masks may still be recommended for people who are unimmunized, but that will be more about a personal choice, like understanding your risk, and then you may choose to wear a mask, or maybe if you're at high risk of, getting bad complications for COVID, you would choose to wear a mask, but it won't be about forcing people to wear a mask. So if you think about that, people are going to be moving through society, through malls, through transit, and they're not going to be distanced or wearing a mask. So that really means that the need to put measures in some of these bigger places is much less. So we will see some restrictions, I think, in the very big venues, the ones that have quite large capacities, they will be under some restrictions. We'll see greater restrictions for indoor venues than we will for outdoor venues. And I think we'll see more restrictions in places where people are sort of sat beside each other for long periods of time, as opposed to types of things where people can move around and moderate their own risk, like in a fair or a festival or a trade show. That's sort of like being in a mall, and people can decide, do I want to be close to people or do I want to be away from people? And they can make those choices. So I think we're not going to see a lot of restrictions there. Yeah, so I can't give the numbers, unfortunately. I know the sector wants to know, because of course they want to plan and we want them to do this. And I mean, I don't even know myself what the numbers are going to be. We've put forward recommendations and they're being discussed by cabinet and at the highest levels now. So, but I do understand that on June 29th, when the provincial health officer, announces that we'll be moving into step 3, that they will be announced at that time.
Over the past year, inconsistent communication was a big frustration for the performing arts. Interpretation of health orders between different agencies and health authorities made it very difficult for organizations to plan effectively. As we move into step 3 and 3, 4, and onward, how can we ensure that the performing arts are asking the right people and the right people have the right information? I don't know who has the best answer.
Yeah, I don't know. I mean, I think this is always a challenge, and it has been a challenge throughout the pandemic. We don't normally function like this, where there's broad public health orders across all of society, and they affect so much. And they have to come out quickly as well, because conditions change and they're needed urgently. So, it has been difficult for operators, I'm sure. I think the good news is, though, that as we get to July 1st, there's going to be many fewer orders, and they're going to impact many fewer places. And so I think it will be a lot easier for the people that are impacted to reach out to people, because also the people enforcing the orders, so like myself, will have more capacity to respond directly to them, because it's not all of society that's affected and then asking questions. So, some questions will need to come to the health authority still, some will need to go to the office of the provincial health officer, and some will need to go to WorkSafeBC. We all have slightly different focuses.
Yeah, I think I would just add that the fact that the three of us are on this call representing agencies is a really good sign. We've learned a lot over the course of the year, even amongst ourselves, about who does what and who to contact. Back to your question about consultation, I know that this isn't exactly what many folks and industries had expected with it, but I can say that since Restart was announced, there has been possibly almost daily consultation with WorkSafeBC and public health and the health authorities at the government level. So there's ongoing conversations. And when we get to releasing our guidance, you can be comfortable and sure that it's taken a while to get there, but it's going to be very clearly aligned with whatever is coming in the next stage.
So staying on you, Lisa, so this next question is, WorkSafeBC has submitted a proposal to the Public Health Restart Advisory Committee, which includes a framework for employers to manage risk over the coming months. When the framework launches, will it include guidance specific to the live performing arts sector? There is a concern that the performing arts will need to wait longer than other sectors for guidance.
Yeah, so I think there might be a couple of things there to unpack. The short answer is, there will be guidance coming out. Again, we are, making sure that it aligns with whatever the requirements are come step 3. We will start consulting with industries as soon as we're able to publish that guidance. Dr. Henry has made reference to contagious disease plans and a more general framework and our job will be to be supporting employers and what that means and what that looks like as we kind of step away from orders pertaining to the kind of safety plans that we've gotten used to over the course of the last year. So when the new guidance comes out, which I'm hoping will be posted very soon, it should be very clear to employers what they need to do. As far as I know, it's more of a general approach, general framework. As Dr. Lysyshyn says, we're moving towards restricting less restriction and lifting orders. And any of the industry-specific guidance, I believe, would be coming from the public health, any residual restrictions that way. And then we would be working with employers to make sure that they understand that.
Yeah, and really the types of restrictions I think that would come to this sector will not be on the performances themselves. I think there'll be almost no restrictions there. It will really be on the venues and sort of, what their capacity can be. So that's the type of restrictions. The performances themselves, I don't think there'll be any restrictions.
Okay, thank you. As a reminder, if anybody has questions, please put them in the Q&A window and we'll try and get to as many questions as possible. The next one is Actsafe. So Actsafe recently launched the BSAFE COVID-19 Safety Certificate Program. Who should be taking this program? And in addition to better understanding safety in the workplace, how do you see it being used to increase public confidence?
What a fabulous question. So BSAFE was launched, I guess, a week and a half ago now. It was launched in partnership with GoToHR, and the ministry asked us to bring it forward to the arts side of the ministry. So we didn't create the course, we are delivering it on behalf of GoToHR in the ministry. So that's why it is very much tourism industry focused, but we felt that the content was great and it works across multiple industries. A lot of different industries could use this, especially for their frontline workers. As far as how I see it rolling out, this is a fabulous tool for all of our groups to get their front of house managers, their front of house staff, their volunteers through a program that gives them a very general look at what to expect with COVID precautions and ways to deal with some of those situations that you're going to encounter with the general public coming into your venue. It's free. All you got to do is register through our website, and you get your code to do the course, and it's only 90 minutes long with a 10-question quiz at the end. So we've had about 100 and some odd people take it so far. So if you have any other questions, please feel free to reach out to me. But in general, for anybody who's got, it's a great free resource for anybody that's got volunteers or people that have been out of the workplace for a while. Having these protocols and bringing them up to speed on them will be really key. as well as orientation for everybody needs to be reoriented when you go back into your workplaces. Remember that one. How'd I do, Lisa?
Good, awesome. Can I add an extra plug for it a little bit?
Yeah.
You know, I do think this is fantastic training. It came out of there was a tourism task force last fall, and one of the recommendations was to develop some more formalized training to help improve consumer confidence and set some baseline and some consistency amongst a number of small employers. So at that time, it was recognized, which is fantastic, that performing arts is a huge piece of tourism and hospitality. And so I'm just really happy to see that there's been this kind of bridging of some of the industries that I work in. I wanted to plug the content. There's an aspect that I like a lot that I think is going to be a very relevant conversation for many of us in the coming months, and that's around dealing with, you know, people that everybody's going to be on the spectrum of their comfort level and what they think applies to them. And unfortunately, employers and workers are often the ones that are bearing the brunt of having to deal with those disgruntled clients, if I can say that, or people that are not understanding what applies to them in that moment. And so this course actually does try to do some training around that, and at least names it and names the requirements of the employer to create a safe space for those workers and to be considering all aspects of, you know, frankly, violence risk assessments and things like that, because that's an important topic I think that we can't lose sight of in the coming months.
Great, thank you. The next question, I think this is for Haley. There's been the small group conversations with arts leaders within the community that you've held over the last number of months. How do you see this consultation group to continue moving forward?
Yeah, and I don't want to speak for Dawn, but I think that it's been helpful for the office to be engaged with this work. And I feel that I still will be engaged going forward, even as we start walking back the PHO orders and the public health guidance. So that's my commitment, to continue to stay engaged with our little group. And yeah, I think it's been working really well.
Thank you. Do you have any guidance around children's theater or theater activities that involve children, given that those under age 12 can't get vaccinated yet and will be at higher risk of both contracting and transmitting COVID for some time to come?
Maybe just an introductory comment, like the idea of the restart plan is that we're making these steps because it is safe for our whole population, right? Immunization protects the individual, but it also protects others by stopping transmission and things like that. So yeah, so we're loosening these restrictions, understanding that children under 12 are not immunized. We also know children under 12 are less likely to get COVID, less likely to be involved in COVID transmission. So they already have a bit of a natural immunity that the rest of us adults actually don't have. So that's actually a good thing in this. At some point, children may be immunized, but we're moving ahead with the restart plan, understanding that children are not immunized. And so no specific plans are really necessary for that. There will be some specific work done in the school sector as well, you know, to make sure that schools are safe going into the fall, but we're not requiring specific plans for activities with children.
And Mark, if we can stay with you, because there's the questions around the Delta variant and how that may or may not affect the decisions around the restrictions moving forward.
Right. So yeah, so there's always been variants in the COVID virus, and we've already seen certain variants predominate in BC, and we saw that even before you know, variants of concern had a name. For instance, very early on in the pandemic, it wasn't the Wuhan strain that was circulating here, it was actually the Washington State strain that was circulating. Even though our initial introductions were the Wuhan strain, the Washington State strain just outcompeted it and it was circulating. So, you know, now we've seen the UK variant, the Brazil variant come and become kind of the predominant variants in BC, and they're called variants of concern because they're believed to spread more easily, and thus they become the predominant variants. So we've started seeing the introduction of the Delta variant, or we've had the introduction of the Delta variant, and it is increasing as a percent of the as a percentage of all COVID cases. I think we're up to about 6% of cases are the Delta variant. And so, but it remains to be seen whether it will outcompete the UK variant or the Brazil variant. It may, and we'll have to see. But the good news is all of the things we've done to control COVID, work on these variants so far. So all the measures we take, all the advice we give, and then finally the immunizations also. So they work. They may not work exactly the same, but they, so far they still work. So this isn't really affecting our restart plan at all. I mean, of course, we're monitoring it. The UK has had a little bit of a resurgence related to the Delta variant, but we've looked at their epidemiology and our epidemiology quite carefully, and that's really a resurgence in unimmunized young people. And their young people in the UK are less immunized than ours are. For instance, in the under 40 group at the time of this resurgence, they had only 33% of their people in that age group immunized, where we had 66% of that age group immunized. So, they were a little bit at risk for that type of resurgence where we felt we weren't. So, or that we're not. So we're moving ahead with the restart plan, but we are going to have to continue monitoring COVID, of course, and looking at the new variants and how they respond to the vaccine will be a very important question. And this is why for influenza, for instance, we need a different shot every year that has different strains of influenza. And it's possible that at some point a variant will come out that's not covered by the vaccine, and we'll have to get a booster that has a different antigen in it. But the good news about that is these new platforms for making vaccines, the mRNA vaccines particularly, are actually very rapid. And so they can actually take a new antigen and make a new vaccine quite quickly. And so I think we're in a good position sort of as a society to respond to variants, even if they seem to evade immunization.
Thank you. This is for Lisa. Masks have been required in many indoor settings since November. However, on WorkSafe's website, the Performing Arts COVID Safety Plan document not only describes masks as optional, but requires users to tick a box saying, we understand masks should only be considered when other control measures cannot be implemented. Can you please clarify WorkSafe's stance on mask usage?
So I can say that I think from day one, masks have been a very contentious topic. I think the very first question I was asked once we were in COVID land was, do I have to wear a mask? Do we have to wear a mask? And so if you'll indulge me for a second, I guess to go back a little bit from the beginning and how our thinking came about was, early on, masks were not mandatory. They were one key piece of protection that we put in the category of PPE, personal protective equipment. And everybody was jumping to masks as being the thing to do or not do. But there were many other controls ahead of those that we were trying to really make sure people were focused on. So not going to work in the first place, if you can, eliminating the risk, distancing, all sorts of barriers, all these other pieces so that people would not only focus on the mask part. So that was kind of the genesis of our protocols, making sure that as you were working through your safety plan, that you were working through what we call the hierarchy of control, and then you get to masks. Then over the course of the year, guidance around masks, which is our protocols have never meant to conflict in any way with public health orders or any guidance from public health. And as guidance changed from public health office, so too should the usage of masks in the workplace have changed. But the requirements for masks still weren't always the same in every situation for every scenario and even in every workplace. So, we've had our protocols in place, and as things have changed a lot in the last number of months, now we have the situation where the workplace safety order dictates in a work environment where masks are required. We would be expecting employers to update their safety plans accordingly and be following any of the guidance from public health, which is what we have up there. And maybe you can remind me of the back end of that question, because I know I put a lot of preamble there, but Tail end of the
It
question?
was, well, it was mainly around what's on your website right now
Yeah.
versus what's, I guess, in the
What's
orders.
what's coming, you know, clearly on our website right now, I think we put the caveat out there that as things are shifting with public health, that's your main go-to for guidance. And that our protocols are kind of best practices and ways of doing, you know, fulfilling those requirements. I expect that those protocols the guidance, all of everything on our website will be updated in short order here as we move towards new guidance, but we'll always be following and be lockstep with what public health is suggesting or requiring.
Next question is, other provinces are implementing government-issued vaccination cards, such as QR codes for easy scanning. This card is allowing vaccinated people entry into events, care homes, and restaurants. Is this being considered for BC?
This is something we're not considering. We find that schemes like this have significant equity concerns. And so it's not really an approach that we want to take here. Like I kind of said before, we feel the restart plan is safe given our level of vaccine coverage. It's safe for everybody. So yeah, so we're not recommending that. I mean, in this next phase also, what's going to be, and this kind of relates a bit to this mask question, there's going to be a real shift around how we think around masks, because up until at this point, we're told to wear masks. And with this shift into step 3, it's really about putting the choice back onto individuals who understand their own personal risk and them deciding whether they want to wear a mask. So, you know, it's going to be recommendations that are a bit more, you're recommended to wear a mask if you're unimmunized in an indoor public place, for instance. So it'll be up to the individual to decide if they wear a mask in that situation. And basically, we're also going to ask people not to ask people if they're immunized, because it's private information, it's not their business. And then finally, to respect people's decisions to wear a mask or not wear a mask. So, you know, the kind of thinking around masking is going to change with this next phase. And it'll be more about individuals deciding rather than sort of authorities telling people to mask or not to mask. Now I also lost the question too. I can't remember if I actually did answer the question. Did I answer the question?
Follow up on that then. But if let's say an organization or venue is more comfortable having all of their patrons wearing a mask for the next 4 months, like just to allow for knowing that the comfort level of their audience is actually with masks, can they require all of their audiences to wear a mask?
Right. So, I mean, we understand that, like, as of July 1st, it's not going to be possible necessarily to remove all the measures that have been implemented as a result of COVID, right? Some workplaces are massive, and to take down every directional arrow sign and every piece of plexiglass, and you know that's a process. And so we understand that workplaces are going to need to work through that process. And yeah, there may be measures that people want to implement to improve consumer confidence. And you know, we've seen some of those measures implemented in BC, for instance, BC Transit and TransLink, you know, requested patrons to wear masks in public transit. And that wasn't a public health recommendation. That was their business decision to do that because they thought it would help people feel safe in transit. And so we may see some venues choosing to do things like that too. For instance, seating groups of spectators together and then distance from other groups of spectators. That may be the kind of thing that they choose to do, or they may, you know, ask people to be masked or things like that. But you know, but there's also risks to doing that, those kinds of strategies too, because that may deter people from coming when masks are not required anywhere else. So you know, the venues will have to think about that, and we will probably be through a transition phase as people phase out the COVID safety measures and kind of, you know, arrive at the new normal. But the idea that we would request people's vaccination status is something that we're really not supportive of in BC, and you know, the provincial health officer has said that already, and I think we would continue to not support those type of approaches.
Okay. So this one is about outdoor. What are the best practices for outdoor art activities involving all ages in July?
The best practice, well, it depends on what kind of an event, I guess, but and whether they will come under restrictions as of July 1st or not. And as I've mentioned, I can't I can't say what those exact, what will be the maximum number that's allowed. And, I have certain ideas about, I think, what types of venues will be restricted and what won't, but that also could change in the final decisions too. So we'll really have to see that, I guess, really on June 29th, up to what number can people have? And then is there a capacity limit? Is there other restrictions?
The next question is, I'm not sure who's going to answer this one. So when it comes to the long-term strategy for the performing arts, when reflecting on the last few months, there's mentions about churches reopening sooner than, or religious services opening up sooner than performing arts. And the question is asking about how do we ensure that performing arts is treated equitably with like activities moving forward? Is that more consultations? Is it a reclassification of performing arts? What can we do?
I think they will be treated equitably. I don't see greater reopenings in terms of religious gatherings versus other types of events. At least stepping into step 3. So I don't know. I don't see in step 3 a great disparity between them, at least from what I've seen of what's going to happen with step 3.
John?
The specific example I'll give you is in the current orders for faith-based services. There's a little line about 10% in venues that are larger over a capacity of 500. That is something that could very easily be applied to the live event, to indoor venues. So that was one of the big questions. I can tell you I've got about 15 of them in my inbox. That question came up. So that's one of those things that I was trying to get the point across, that could easily be applied to our side the same way. And that's kind of where that equity piece comes into that question.
Yeah, I mean, I think these equity questions will, there'll be much less of them as we move into this next phase, because many fewer places and venues and sectors will find themselves under any restrictions at all. And so, so I think the next phase or the next step, I keep calling it phase, next step should look better.
This is this is a really big tease for me, right?
Well, I mean, I think it is exciting, like we've all been under these restrictions for so long, and we want to get all of these, and this is the point of this restart plan, is these orders are very restrictive on people and on entire sectors and businesses, and they were justified when they had to protect, our healthcare system so that people could survive the pandemic. But as we become protected against the virus, they're no longer justified, and we really need to remove them so that sectors can flourish again.
Yeah, I would just, no, I'm not on mute, sorry. Just getting back to what you talked about earlier Mark, around business decisions, that, that we recognize that there's going to be like really a multitude of efforts on the part of employers to understand sort of who's saying what or who's not saying what anymore, and to be clear when they're doing something that's a business decision or a personal decision or a directed decision from an agency. And sometimes it takes a little bit of work to kind of be clear on where the direction is coming from and where there's wiggle room for who, but having that basis on which you're making your decisions will make it, and then communicating that to your workers and your patrons, we're doing this because this, that'll help. So I think communication is going to be so important in the coming few months, just so everybody's clear why certain things are happening or not.
In speaking to communication, one of the things that has come up recently, and well, not just recently, but what role does the province play in order to ensure that patrons are informed about safety coming back into, in particular, performing arts spaces or cinemas and those kinds of spaces. Yeah, so what, I don't know who answers this question, but how can,
Yeah, I think it's about communication. And this step 3 is really, we're moving into a different phase, and it is going to require quite careful communication. And one of the challenges with this restart plan and at various phases in the pandemic is it's challenging for officials like the provincial health officer to speak about a future phase. Because first of all, we haven't arrived there yet, and COVID cases could change, so it's hard to do that. And there's also, we don't want to give people the idea that that's the behavior we want right now, because we've timed these phases quite carefully, and we want to start phase 3 2 weeks after the entire population has had the entire eligible population has had an opportunity to have their vaccine and thus develop immunity. So that it's timed that way, and so we don't want the behavior to change too early, because that could set us off from doing the future thing. And so that's always been, that's a current challenge. So the provincial health officer has signaled some of the things that are going to be part of step 3, but has not really fully communicated what it means and what's going to be happening. And so that will start on June 29th, I guess, officially, but that's a real challenge, because it does take people some time to kind of understand, and not everybody's going to hear that communication, and so but basically once that step is released, I think the communication can really start. And I know there's a whole team in the government kind of really working on this, because this is a real communication challenge now, because again, it's this big shift from government and authority telling you what to do to individuals deciding what they should do based on their own susceptibility. So this is really different. And the public also may not understand like how protective immunization is, how it really does reduce the risk, both of getting COVID, but also of particularly getting serious illness. So this is going to take some time.
Don?
Yeah, just to add on to that, there's another communication piece which is missing from this conversation today, which is BC Arts Council, Creative BC, and those partners that are prepping promotional bits that'll help get some of that information out there, which isn't really in any of these groups' purview, but that work is also happening in the background. So, but again, none of that can really happen until we know what the breakdown is going to be. But that work is happening kind of on the side. Haley's heard a bit of it from us and some other groups that we're working with, so we know that is taking place. But until those rules are laid out, that can't really move forward. So there is some of that also going on in the background.
The next question is about a Northern BC organization who said that their community has hit 80% vaccination rate. They are in a joint use facility situated in a school. The disparity, mixed messaging, and acceptable risk between teacher and a theater employee were troublesome and contentious. Like our schools, our facilities need to be open and operational. It's more of a comment than a question, but I guess when it comes to like the different operating models or different kinds of organizations, because that's partly what the plan also included around event-based versus a school had different kinds of restrictions. What's the best way to navigate those kind of intersectional policies, or do you have any comments on that?
Yeah, well, maybe I'll address the first part, the statement that their community is at 80% vaccination rate. So the restart plan is not a community by community plan. It's a plan to remove the state of a provincial emergency in BC and stop management of the pandemic virus like a pandemic across BC. So there are various communities with higher and lower immunization rate, but that doesn't mean that they can move faster on the restart plan than anybody else, because of course, if they start having cases, it spreads somewhere else. So it's not a community by community plan. This is once BC has got to the state where we feel protection of everyone across the province is adequate to start removing the restrictions, then we will remove them. Acknowledging that some communities will be higher and lower. So that just that first part of it. Yeah, I mean, I think schools have been treated differently than other settings in the pandemic, and there's really good reasons to do that. both from the point of view of the essential nature of school, but also the specific risks that are there. And so, you know, they have been treated differently, and I guess it has resulted in some conflicts. But like I say, as we move into step 3, I think, and orders get removed, I think there'll be many fewer of these conflicts.
The next question is about consultation with community. And so Parliamentary Secretary Deeth has been doing a number of roundtables over the last number of weeks, but the focus of those conversations have been not explicitly not about health and safety and returning to arts and culture in that context. And given that, Haley, you've had that smaller group of conversations and people that you're meeting with, is there an opportunity to have a larger conversation with the maybe a broader section of the community, because some don't feel like they're represented by the number of people who are at the table right now?
Yeah, I think that's reasonable. And there was a performing arts sector conversation that Dr. Henry had attended back in, Dawn, can you help me? Was that March?
Yeah, it was late March.
Yeah, and so I was not able to attend that call, but I think it was well attended otherwise, and that folks thought that it was generally helpful. And so I think that Dr. Henry, and if not her, then another representative from her office, like myself, would be able to engage again in another sort of large conversation like that, if the Ministry of Tourism, Arts and Culture was willing to set it up again.
Lisa? Oh, you're on mute.
Got to do it once, right? Once we're clear what step 3 looks like and means for employers, then we mean to do embark on some consultation on our part as well, and that'll be both at the, starting with stakeholders, our HSAs and associations, but also at the employer level as well. And so I would just say stay tuned to our website as well, because I think that there will be some, avenues for asking questions and getting further information. And we will be trying as best we can to cascade the new information out so that people understand what it means as best as possible.
We're about 10 minutes away until we end. So if you have further questions that haven't been answered, please do put them in the Q&A box. This one, are the potential, I'm going to read it, but I'm not sure if this was answered. It might have been answered. Are the potential restrictions on capacity for indoor theater and concert events based on helping people's comfort levels in managing personal risk, or are they based on data around transmission potential? If the latter, what kinds of data would be used to determine the restrictions? I was a bit confused by what the intent of potential restrictions might be for audiences.
Yeah, this is a good question. I'd say it's a bit of both. We do have certain information about how COVID transmits, and we have certain experiences of how it transmitted at gatherings like events or big conferences and things like that. We have experience, following up every COVID case that, for instance, we had in Vancouver Coastal Health Region. So we sort of know how it spreads at those types of events. And so we're willing to make this change based on immunization. But of course, there's a variety of levels of comfort with this. And so the reality of the restart plan is it's a combination of what we think is possible, but it's also possible we could get it a little bit wrong. And so we also don't want to have to step back and things like that. And so that's why there has been, a few steps leading up to step 3. And that's why there's also a step 4. And that's why, we are going to put some restrictions on the highest, what we've decided is the small number of highest risk situations, and we'll see how that goes, monitor, and then, quickly remove those restrictions to make sure that we haven't shot too far too fast. And so, that's the reality. So, but the restart committee at least has tried to do that on, only the smallest number of places that we felt this could be justified. There's also a proposal too, not to monitor all the way till September, is to monitor until the August first long weekend. And there seems to be some momentum behind that. So it may be a shorter monitoring period than people think as well. So it is realistically a combination of both things.
John?
Yeah, I just wanted to back up some of what Dr. Henry has said in some of our meetings, as well as what Dr. Lysyshyn is saying here. I really do think that it was the very broad strokes and the high level of restriction that we put in place, and that they've stuck with the numbers, I think was brave and right, because if you look at other jurisdictions that started to reopen and then had to back up, that was, I think, for my colleagues across the country that had to deal with that, far more damaging. So as much as even me, most people know that I want to do shows, I still think that was the best decision, because rolling those back is a huge nightmare. And that's why whatever restrictions are still in place, I'll back those, because I know dropping them and having to go back is way harder and can be very damaging for groups, as opposed to staying the course and then opening up slowly. So just to back them up on that point, I thought that was a good move, and I've tried to explain that to lots of people that didn't quite get it. But I think overall that was a really good move, and better for us in the long run.
Do we imagine that the COVID safety plans for each organization will be transitioned into a communicable disease plan if it needed to be brought back again? Is that what they should be doing or thinking about?
You mean like once we transition to a communicable disease plan, is there a possibility they would have to go back to a COVID safety plan?
Well, they have their COVID safety plan right now for their organization. At some point, is that going to be thrown out, and they're like, we don't actually need this anymore because we don't need the COVID safety plan, and that's just the title of it's just going to change to communicable disease plan for when a new pandemic comes?
Well, I mean, you should never throw away what you've learned. So we want everybody to keep what they've learned. But I think the idea is that, this specific singular focus on COVID in the workplace is no longer justified. And we need to move people into a more general focus on the communicable diseases that spread in the workplace. And that's the sort of transition. Now, I can't predict the future, so I can't say that COVID won't, there won't be a variant, there won't be a new COVID, there won't, that whereby we might have to go back to, COVID, 2.0 safety plans, so that is possible. But based on what we know now, we think that this shift from the singular focus to this more, more general kind of communicable disease prevention is really the right step right now.
And over the past year, organizations have looked at many ways of reducing the risk of transmission, including improving HVAC systems, which can be costly, and adding UV light. Should we continue to prioritize those types of improvements, or should we focus on less costly but effective methods?
I don't know if Lisa wanted to say something to that previous question.
Yeah, I was just going to point out that I think one thing that's really interesting in this transition phase is that we're going from public health issued orders around workplace safety and trying to sort of figure out how that transfers over into our domain and our legislation, because we've been sort of able to enforce and point to requirements based on those orders. And so as we move into a more sustainable, long-term sort of overarching plan for contagious diseases, what does that look like in terms of our legislation? And so that's part of what's kind of, I think, personally, some of the interesting transition that's happening here too. So we hang on to some of that for the long run. For other instances, we keep our learnings, but it's not so COVID specific. Anyway, I was just gonna add something on there.
Yeah, and then with regards to HVAC and UV light systems, we've never thought that HVAC systems really play a large part in COVID communicable disease control. We want HVAC systems to be functioning properly for a variety of reasons. And so that's really what's required. So people need to continue maintaining their HVAC systems so that they work as they're supposed to. In terms of cleaning, we're recommending that people return to routine cleaning, to not special types of enhanced cleaning, to just the routine cleaning that people were doing basically before the pandemic, because we also know that surfaces is not a major way that COVID is spread. It's spread from person to person, often through face-to-face interaction with people that we know. That's how it's spread. So this focus on cleaning, it got kind of taken a little bit too far. And now is time we can kind of scale that back. So if UV cleaning is a good cleaning for your industry, then you can continue to use it, but it's not, anything more than what would be routine cleaning is not what's going to be recommended going forward.
Okay, as we wrap up, I'm just going to highlight a few things. We didn't get to all the questions, but that's kind of what happens in these situations. June 29th is when you said, Mark, right? Is when Dr. Henry is going to announce more specifics about step 3. So we should all be looking out for that. We don't know, based off of some of these questions, we don't know what the numbers are going to be in terms of increased capacity for indoor and outdoor activities. We have to wait and see. There's going to be reducing of the restrictions or easing of restrictions as we move forward. We'll have to keep an eye out for the new framework that WorkSafeBC is coming out with. Is that right? Or new protocols once the information is available. And do we have a date for that, Lisa? I guess we don't, right?
I would say soon. It should be available before June 29th.
Oh,
so
great.
Start to see what that looks like. Yeah.
Perfect. It's always nice to have a date that we can think about. And then
we'll try and come out first.
And then for Actsafe, there's the BSAFE program, the COVID safety training program. And then Dawn, you're still receiving COVID safety plans, and and you can continue to review that for organizations that require it.
Yep,
right?
absolutely.
And then for Haley, you're going to continue to have those conversations with the small group that you have in order to ensure that the province is responding to the performing arts sector and the arts sector as a whole. And maybe in the future, there could be a broader cross-section of conversations, either directly with Dr. Henry, but certainly with the office, so that more people feel like they're included in that conversation. Did I encapsulate all the key points pretty well?
Great job.
That was great. And maybe I would say, as we reopen, there obviously will be questions, but, happy to participate in webinars like this again, as, different steps happen, and, there'll be more and more questions as each steps happen. So, happy to participate again.
Hey, maybe you should be a guest on What Would Dawn Do? That's an extra special thing.
So at this point, I'm going to say thank you to Haley, Mark, Lisa, Dawn, Sharon, and Carmen, who are our interpreters, and for everybody who attended today and submitted your questions. Certainly, there are going to be continuing questions moving forward, and we're trying to get through it together as an arts and culture community, as a performing arts community. And there is a recording of this that we're going to post on our website in the next couple of days. So thank you, everybody. I hope you have a really great rest of your Wednesday, and I look forward to working with all of you again soon. Bye.
Thank you. Bye-bye.